An emergency room nurse is assessing a 26-year-old female patient who frequently uses opium. What symptoms would indicate that she is experiencing withdrawal? A. Diaphoresis, seizures, and apathy. B. Irritability, tremors, and seizures. C. Nausea, vomiting, and anxiety. D. Fatigue, disorientation, and craving. The answer is C. Nausea, vomiting, and anxiety. Anxiety, nausea, and vomiting are common symptoms of opium withdrawal. A nurse is monitoring an 18-year-old who is experiencing heroin withdrawal. What symptoms might the nurse observe? A. Seizures, tremors, and tachycardia. B. Nausea and fainting. C. Yawning, cramps, and diarrhea. D. Coma and convulsions. The answer is C. Yawning, cramps, and diarrhea. Yawning, cramps, and diarrhea are common signs of heroin withdrawal. Which of the following drugs is considered a central nervous system, CNS, depressant? A. Marijuana. B. Nalol. C. Cyclobenzaprine. D. All of these. The answer is D. All of these. All of the drugs listed are considered to be CNS depressants. While generally classified as a psychedelic, marijuana has multiple central depressant effects such as sedation and muscle relaxation. Also, alcohol is another commonly used depressant. Alcohol abuse-induced thiamine deficiency can cause which of the following? A. Wolff-Hirschhorn syndrome. B. Lewy body dementia. C. Agnosia. D. Wernicke-Korsakoff syndrome. The answer is D. Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is caused by a severe deficiency in thiamine, often seen in severe alcohol dependency. It is characterized by visual disturbances, ataxia, and altered consciousness. Wolff-Hirschhorn syndrome is a genetic disorder causing developmental disability and may involve seizures. Lewy body dementia is associated with Parkinson's disease. Agnosia is a neurological disorder causing impaired ability to process sensory information. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, criteria for substance abuse includes all of the following except dash. A. Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. B. Recurrent substance use in situations in which it is physically hazardous. C. All of these are part of the DSM-5 criteria for substance abuse. D. Continued substance use despite having persistent or recurrent social or interpersonal problems caused by or exacerbated by the effects of the substance. The answer is C. All of these are part of the DSM-5 criteria for substance abuse. All of the items listed are part of the DSM-5 criteria for substance abuse. In addition, the individual's symptoms must not qualify for substance dependence, and recurrent substance-related legal problems are other DSM-5 criteria for substance abuse.